If you haven't purchased your tickets yet for the Split the Pot lottery, you'll want to do so before this Thursday if you want to have a chance to win up to $100,000 in early prizes. Now, the lottery supports 58 hospitals across the province for critical care and much-needed equipment. Joining us now is our good friend, Paul McIntyre Royston, President and CEO of the Grand River Hospital Foundation. I say that because you've been in a few times, and I'm always happy to see you. And it just feels like this initiative keeps growing and doing more and more good work. So tell me about where we're at and why is this so important to get those tickets before Thursday?
Yeah, you know what? It has been growing. It's doubled the last time. That's what we're hoping for this time. And tons of early bird prizes this time, 34 winners in total. Different than sort of those other lotteries. There are so many winners here. And, you know, it's been growing because it's helping, because it's making that difference with equipment in hospitals across the province.
Sometimes people don't understand the importance of fundraising. They think, oh, free healthcare in this country, the government pays for it, our tax pay for it, but that is not the case.
It's really not. You know, we often say at our hospital, the government gets us to good, makes sure the core is there, but it's the community that gets us to great. And every piece of equipment, from a bedpan to an IV pole to a bed, has to be purchased locally by the community.
Wow, it is phenomenal. And you have an option, because I know this covers 58 hospitals, but you can say the money that's going in, the tickets I buy, can go to a specific one or all across them? You do have that option?
My in-laws are up in Bobcaygeon, and they like to buy tickets, but they want to support their local hospital in Peterborough. And so they don't buy the Kitchener ones, but they buy those, which is great, right? And ultimately, all of it's about sharing, but you can actually dedicate your winnings to the hospital of your choice.
So when it's Split the Pot, there's the part that's the good work it's doing, and then there's the part that goes, I kind of want a little bit of a payout from this. Tell me a little bit about how this is done, the Split the Pot works, and then we'll talk about the ticket purchase.
Yeah, so there's, in the end of the day, after the early birds, the 100,000 early birds, there's 13 winners. And they split the top jackpot. They split it 60, 20, 20, 10, 10, 10, 10. They split it up. And so, but it's great. Like the last time we called a Toronto winner, and the top prize was 660 grand.
Wow.
And that's life-changing.
It is life-changing.
Right? That is, your mortgage is gone, whatever, it's incredible.
You're
and
taking
so,
more trips, you're helping the family. And you're giving back maybe too, because
he said he wanted to buy a boat. It's a really nice boat.
I hope you got an invite out of that boat. Okay, let's talk about the purchasing power, because I saw in some of the notes that you could get a ticket for as cheap as 16 cents.
Yeah, if you spend, you can get 600 tickets for $100, and there's 3 tiers down. Starts at $20, so I want it to still be accessible, but also want to help our hospitals. And so that's the feel around this whole one. How do we help this grow? How do we help hospitals across the province?
So we were talking a little bit about that this is becoming a more and more successful initiative. Take me through that timeline, both in terms of how this has grown, in terms of the pot growing, and also how that's been able, in turn, help all these hospitals that are kind of involved in this.
Well, what's been really special is we've grown. We started with 21 hospitals with our first round, and now we're at 58. We expect to continue adding. There's 141 in the province. And we've heard from a lot of little hospitals in the community as well, in different communities across Ontario, that they can't do these kind of things on their own. So, you know, some hospitals run lotteries and so on, but it's really hard when you're a small little organization, a tiny town, or whatever, to just pull that off. And so by banding together, by hospitals saying, yeah, we're in it to win it, we allow that to happen and allow it to grow big. And so it's win, 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 win.
I like those wins. So where do we go? Where do we go from here? I mean, there's got to be that sweet spot where things got to plateau, because the average person doesn't have. What is kind of the hope for this fundraiser initiative in the years to come?
Well, fundamentally, we'd like to be the premium multi-partnered lottery across the province. So, you know, everyone's saying, this is it. This is the one I want to get in on. This is what I want to win, and I want to be with help these hospitals. So, you know, I could envision it easily going, you know, another 0 on the end there as we grow, and being something really special for the province.
It already is something very special. And I like where you're taking it. Splitthepot.ca. Got that right? Super easy. Get in there before Thursday. We love having you here. Thanks for all the good work you do.